I recently sat down with a friend of mine, Paula, who's not only a sailor but is also a school nurse. In this video, Paula will talk about advances in rescue medications for seizures and how they're applied in a school setting. So Paula, thank you for taking the time to join us. I really appreciate it. Now, do you have access to rescue medications in your school for certain children?
I do. We have had that for years. Up until recently, they've been rectal diazepam, which since I work in a high school, I remember distinctly, and this is something I always think of when we went to the nasal. Like this year, all of my students that have epilepsy that have rescue meds have a nasal
Yeah.
administered form. I had a boy who a teenage there's not a teenage boy in the world that wants to think that the school nurse is going to see his butt and put medication up his butt should he have a long lasting seizure. And I
Yeah.
feel like it adds a layer of stress to these kids that they just don't need.
Yeah.
you
Yeah.
know so this is wonderful. And I think it also takes a lot of stress off the parents. So
Yeah.
the ones that I do have that have rescue medication, and it's usually, if the student has a history of having seizures fairly often, if they're not well controlled, or if, when they do have them, maybe they have a very long one. Usually it's for over 3 to 5 minutes, or maybe they have one and then they have another one and then they have another one, and you have to stop that cycle.
Yeah.
Those are usually the ones. So right now I currently only have, out of my maybe 6 or 7 kids that have epilepsy, I think I have 2 that have rescue medication.
Yeah. So for, a lot of people don't actually know what a rescue medication is. And so just to contrast it, like I take anticonvulsants in the morning and nighttime. It's an everyday thing. And a rescue medication is really an immediate delivery when somebody is having a very prolonged seizure or just is continuously going into seizure and seizure. So it's really just to rescue them and
Yep.
manage to stop those unremitting seizures. Yeah, I think they're an incredible development. And if I was in school, I would be really happy that there was a nasal mechanism rather than the rectal strategy.
Oh,
I think it's an incredible breakthrough.
it is an incredible breakthrough. It's an incredible breakthrough for the families, because I've actually had the discussion with families who are very nervous about having to give a rectal medication. But again, both of those means are so readily absorbed, right? They get to a
Yeah.
mucous membrane and the medication works instantly.
Yes.
So I'm sure that's why, but you know, it's so much more convenient to have a nasal medication.
Do you think there's any better way that schools could be prepared for students with epilepsy in order to support them or treat them should they have a seizure? I do know in other states there are very active parents of people with epilepsy who are actually getting legislation passed requiring all staff in schools to be taught epilepsy first aid.
Yep.
Yeah, and I think it's helpful in many respects. First, it's going to help the student. Second, it's going to reduce some of the stress associated with somebody having a seizure. It will become, okay, we know what to do. So I think for those reasons, it's extremely good.
I've actually done trainings with, in our district, I've done trainings with bus drivers, I've done trainings with teachers. Usually I don't just give the paper to the teacher and say, this is what I actually go talk to them and say
Yeah,
this, and a lot of them have been teaching a lot of time, have had a kid have a seizure in their classroom, and, are pretty good, right? Because like the first aid is really pretty easy and
yep,
pretty simple,
yeah,
just make sure they don't get hurt, really.
absolutely. And, maybe if we have more training, the stigma associated with epilepsy will decline as well.
For
Because,
sure.
it's just another disorder. Just happens to be one that you lose consciousness, and some depending on the type, you can have these movements.
Yep.
Yeah. Are there any other thoughts you may have about children epilepsy, and how schools should deal with things?
I don't think so. I mean, I love the idea of promoting normalcy.
Hmm.
Like they play basketball if they're basketball players. They run track. They do, in my school, it's you do all the normal things that you're capable of doing as a human being.
Yeah.
And then we figure out, the school has to figure out, and I understand that's the law, but nobody gives anybody a hard time. You know what I mean?
Yeah.
Um, yeah. And I think to encourage that is terrific,
Yeah.
and I think that's part of the mission for your group, is encouraging normalcy for people with a diagnosis of epilepsy.
Absolutely. Yeah. That's right. Take one more step to live a fuller life. Well, Paula, thank you so much. I really appreciate your insights, and thank you for what you do for the students and for the staff.
Thanks.
I'm sure it's really helpful.